Let's talk about something that touches so many lives, but is often surrounded by a lot of silence: miscarriage. In this explainer, we're going to walk through what it is from a medical standpoint, what causes it, the different ways it can happen, and what the pathways to care look like. Our goal here is to just bring some clarity and understanding to a really vital part of reproductive health. Okay, so first things first, what exactly is a miscarriage in medical terms? Well, it's defined as the end of a pregnancy before the fetus could survive on its own. This is often marked by the expulsion of an embryo or fetus that weighs 500 grams or less. You might also hear the term spontaneous abortion in a clinical setting. It means the exact same thing. This definition gives us a really clear place to start. So, just how common is this? The number might actually surprise you. About 15 to 20% of all known pregnancies end in miscarriage. That is a really significant number, and it highlights something crucial. If you or someone you know has been through this, you are so far from alone. Now that we have a definition, let's take a closer look at the biology of it. What is actually happening inside the body during a miscarriage? This here shows the typical biological sequence of events. It usually kicks off with some bleeding in the uterine lining. This can, in turn, lead to tissue damage, which then causes the conceptus, that's the clinical word for the embryo and its surrounding membranes, to detach. And from there, the body initiates uterine contractions to expel the tissue. It's a really complex but natural process. And that brings us to the question that weighs so heavily on so many people. Why? Why does this happen? Let's dive in to some of the known causes and risk factors. It's almost never just one simple thing. The causes are often pretty complex and intertwined. To get a better handle on them, they're usually grouped into two big categories: factors that have to do with the fetus and factors that have to do with the mother. So let's start with fetal causes. And this is a really crucial point. The vast majority of early miscarriages happen because of issues with the developing embryo itself. Most of the time, it's just a random chromosomal abnormality, like having an extra chromosome. In these cases, the pregnancy just wasn't viable from the very start, and it is absolutely no one's fault. Now, on the maternal side, the factors are a lot more varied. They can be anything from issues with the mother's immune system to the physical structure of the uterus itself. Other things that can play a role include uncontrolled health conditions like diabetes, certain infections, or even exposure to environmental toxins. And beyond those direct causes, there are also certain risk factors that can increase the likelihood of a miscarriage. These include things like maternal age, being over 35, having a history of multiple pregnancies, having had a miscarriage before, or carrying multiples, like twins or triplets. Okay, now that we've covered some of the why, let's break down the different clinical types of miscarriage. See, it's not just a single event. It's a process that can show up in several distinct ways. This slide gives you a great overview of the main clinical types we're about to cover. Terms like threatened, inevitable, and missed, they each describe a different presentation of pregnancy loss. And understanding what makes them different really helps clarify the medical approach for each one. Let's start with a threatened miscarriage. This is when there are warning signs, maybe some mild bleeding or pain, but, and this is key, the cervix is still closed. The most important thing here is that the pregnancy might still continue, so management is usually supportive, involving things like reassurance, rest, and monitoring with ultrasound to see how the pregnancy is progressing. Next up is an inevitable miscarriage. In this situation, the symptoms are more severe. We're talking heavy bleeding and pain, and crucially, the cervix is open. This is the sign that the pregnancy can't be saved. So management shifts to supporting the patient through it, which might mean IV fluids and eventually evacuating the uterus to prevent any further complications. With an incomplete miscarriage, the process has already started, but some pregnancy tissue is still left in the uterus. This can lead to continued bleeding and pain. Treatment here is all about removing that remaining tissue, which can be done either surgically or with medication. A complete miscarriage is pretty much what it sounds like. All of the pregnancy tissue has been naturally expelled from the uterus. The signs are that the bleeding and pain stop, and the cervix closes back up. Treatment here is all supportive, focusing on pain relief and sometimes giving antibiotics just to prevent infection. A missed miscarriage is a little different. This is when the embryo has stopped developing, but the body hasn't actually expelled the tissue yet. The signs can be really subtle, like pregnancy symptoms just fading away. It's usually diagnosed during an ultrasound when a fetal heartbeat can't be found. The options then are to wait for the process to start naturally or to intervene with medicine or surgery. We should also quickly mention two other important types. Recurrent miscarriage is when someone experiences 3 or more losses in a row, and that usually prompts a much deeper investigation into underlying causes. A septic miscarriage is a medical emergency where an infection develops, and that requires immediate treatment, no question. So, this brings us to a really critical part of the whole conversation. How is a miscarriage managed? And what does support look like for someone who's going through it? Okay, so no matter what type of miscarriage it is, the very first step in management is always a thorough clinical assessment. This means checking vital signs like blood pressure and pulse, doing physical exams, and using tools like ultrasound to get a really clear picture of what's going on. This assessment is what guides the entire treatment plan. This quote right here highlights a hugely important aspect of care: counseling. And it's not just about emotional support, it's about providing clear, reassuring information. One of the most important things to tell someone is that a single miscarriage usually doesn't mean it'll happen again, and hearing that can be such an immense relief. Right, and this just reinforces that point. The journey through pregnancy loss is deeply emotional, not just physical. Acknowledging the grief and providing that psychological support is just a fundamental part of compassionate healthcare. It's so important. It's also really important to be clear on a key distinction here. Everything we've been talking about today falls under the umbrella of a spontaneous miscarriage, which means it happens on its own. This is clinically very different from an induced or elective abortion, which involves a medical procedure to end a pregnancy. And it's also helpful to know that while miscarriage is a very common cause of bleeding in early pregnancy, it's not the only one. Doctors also have to rule out other serious conditions, like an ectopic pregnancy. That's where an embryo implants outside the uterus, which needs immediate medical attention. So we'll end with a question for you to think about. We've seen just how common and complex this medical experience is. So how can we, in our families, our workplaces, our communities, do a better job of supporting those who go through it? How can we help replace that silence with real